So we're going to talk quick today on basically how we break down times within our office. We have what's called prep time, and there's prime time, then obviously there's personal time as well too. The prep time is exactly what it is. It's how we prep before a shift. It's how we prep for patients. For basically, we're prepping for our prime time at that point. So this includes things like make sure that paperwork that we use during that upcoming shift is all prepared. Its names are put on it, dates are on it, it's out, it's ready to go. We're not looking around for anything during that shift at that point in time. Other prep things, making sure simple things like bathrooms have supplies in them, anything like needs to be picked up, cleaned up, moved around, anything like that all gets done during that prep time that's on there. Once prime time hits, there's a lot of action, and the more attention we take away from the patients itself, it takes away from the experience as an overall piece of it. So main things are look at all your patients, look at the list of patients at which you have on that upcoming thing. Are there any conversations that need to be had with those patients regarding schedule, financial stuff, process of their care, re-exams that need to be done or going to be scheduled during those upcoming visits. So that way, if you have to leave a note or whatever, so we don't forget to do those certain things with those people. And then during prep time, that we're doing a lot of is we're prepping the schedule. So we're doing recalls during that period of time. We're doing leads during that time as well too, where we're preparing the practice to grow. We're preparing the practice to function normally. There's a lot of things that happen during that downtime. In my opinion, the downtime is more valuable than the actual prime time at that point. The prime time does not happen without that prep time being important and productive at the end of the day. So that's that part. The prime time is actually, it is what it is. I mean, it's patients coming in, we're checking them in, we're auditing their file when they come in, we're answering the phone, we're checking them out, we're scheduling them, we're collecting money with them to make sure the balance is correct on there. Our job during that prime time is to be focused on that person in front of us. It's to create a great environment in there. It's for them to feel like we aren't distracted with other stuff at that point in time. And we're also organized, we're efficient, we get them in, we get them out. They don't feel burdened by anything at all because we're so committed to them and nothing else at that point in time. The other extra things we may do during prime time is a few quick reminder text messages or emails or whatever to some of those individuals that may be coming in or maybe missed an appointment or whatever may be the case that's on there. Anything else would be just simply auditing files of each person that walks through the door. Are their visits up? When's their re-exams coming? Are their financials up and current? Is their insurance doing what it's supposed to be doing at that point? Are there any other details to their file that we need to be addressing while they're there? Because if they're there, this is the time we can ask the questions of them. So again, prime time, the main thing to understand is that ultimately at the end of the day, we want to be so focused and so committed to that person in front of us. They don't feel like we're being distracted by this, that, the other thing. Trying to do insurance stuff during prime time is not a great idea for two reasons. One, patient feels like you're not paying attention to them, as well as two, so we make mistakes. There's not enough mental energy and time to be able to actually do insurance work effectively when there's people coming in and out type of thing at the end of the day. The more you can condense and put boundaries around those times, the more effective you're going to be with that. Lastly, personal time is exactly what it is. It's what you want to do. I strongly encourage people, get the heck out of here for a portion of the day so that way you can just change your environment, which changes your energy. When you come back in, you're refresh, recharge, whatever you do. You want to go for a walk, you want to take a nap, you want to go to the store, you want to go home, whatever it is, but disconnect a little bit. Personal time is really important to kind of recharge. These are long days sometimes where we've got really ultimately like a 10 to 11 hours time span, but there's a chunk of time, that early afternoon time, that we need to check out. We need to disengage a little bit that's on there. It may only be 15 minutes, maybe half an hour, maybe 2 hours, whatever you choose, but you've got to learn to disengage a little bit so that way you can come back refreshed and recharged for these people in front of us. So again, prep time, it is what it is. Get things ready for that next shift coming in so that way you feel really comfortable and confident that all the details are taken care of, so you're totally committed to that person when prime time comes in, and that's exactly what it is. It's game time. We're focused on that patient. We're efficient with stuff. We're committed. We're disciplined to the actions we're taking along the way on there. They feel like this is a well-oiled machine, as do our minds. We should not feel stressed during that time because we've already prepped for it So that way, when it's game time, we're ready to rock and roll. And that personal time, take it, use it. It's an investment back into you. It's an investment back into the patients, the practice, for you to take that during the day.